So we did our evidence-based practice presentation on maternal depressive symptoms during pregnancy and the risk of ADHD in children associated with that. My name is Nora Ayash.
I'm Hannah Mackey.
I'm Aisha Khan.
I'm Bailey White.
I'm Emmy Matthew.
And I'm Sarah Obadenshaw.
A little bit of background about ADHD. It is a chronic condition that is early diagnosed in the first few years of a child's life. It affects millions of children and continues on for the rest of their lives. And it consists of constant pattern of inattention, impulsivity, and hyperactivity.
Some more background information. So we decided to do our research on this topic because in the recent decade, rates of ADHD have increased by 30%, and then it is also one of the most prevalent neurodevelopment disorders in children, as well as in the year 2016, parents reported over 6.1 million children being diagnosed with ADHD.
So how we formulated our PCOT question was that among clinically depressed pregnant women compared to non-clinically depressed pregnant women, how is the child affected by ADHD during the first 6 years of life? And then through our methods, the databases that we used were Google Scholar, CINHL, Scopus, and PubMed. The key terms that we used for our first search were pregnant, mothers, depression, and mental disorders. Then for our second search, we used key terms mothers, depression, ADHD, and minimal brain dysfunction. And then for our third search, we used prenatal, postpartum, gestation, depressive symptoms, ADHD, and mothers. And for the dates of the articles or studies being published, we narrowed it down to the past 20 years, starting from 2000. And then we formulated to become more specific, so we used our subject heading being depressed pregnant women and children with ADHD.
The original search that we did came up with 1,150 different articles. Came up with 18 articles, and then to formulate our PCOT question a little bit better, we came up with some inclusion criteria that had 8 articles, and then the final number that we picked our 5 from, it came up with 7 articles.
Okay, this is our summary grid table, and I'll be starting with the first article on the graph that Bailey and I reviewed. The purpose for this research that is similar to the other articles was to identify whether maternal depressive symptoms throughout the pregnancy are associated with an increased ADHD symptoms in their children. The sample included 4,777 women and their offspring and were recruited from maternal hospitals in Finland. This was a cohort study, and to measure the child's ADHD symptoms, Connor's hyperactivity index was used, while Beck's depression scale and the Center for Epidemiological Studies depression scale was used to quantify maternal depressive symptoms during and after the pregnancy. The results showed that their mothers who have had a depressive disorder, their children had higher levels of ADHD symptoms. So their findings did show a positive correlation between mothers' depressive symptoms and offspring ADHD symptoms.
The next article that I will be discussing is titled Relative Impact of Maternal Depression and Associated Risk Factors on Offspring of Psychopathology that I reviewed. The purpose in conducting this research was to prove whether there is a connection between depressed mothers and their offspring's developmental, social, and cognitive issues. 7,429 mothers were recruited with varied socioeconomic and risk backgrounds. This was a longitudinal cohort design, and for measurement, the developmental and well-being assessment were used to assess the children, and the mothers used the Edinburgh Postnatal Depression Scale. For their findings, they found that mothers who had depression during pregnancy had more of an increased chance that their child would have cognitive issues.
For the third article, it was titled Prenatal Antidepressant Use and Risk of Attention Deficit / Hyperactivity Disorder. And the study was done to look for a correlation between ADHD children and their mothers who use antidepressant medication during their pregnancy. The study recruited 190,618 cohort study. The study used hazard ratios to associate between antidepressant use and the outcome were estimated using Cox proportional hazard regression models. A standard error was used to adjust for data clustering. Overall, the findings showed that the mothers who took prenatal antidepressants, their children had an increased risk in developing ADHD as a child.
The fourth article we chose was Maternal Anxiety, Depression and Sleep Disorders Before and During Pregnancy and Preschool ADHD Symptoms in the NINFEA Birth Cohort Study. The purpose of the study was to see the relationship between maternal anxiety, depression, and sleep disorders before and during pregnancy and risk of having ADHD symptoms in preschool. They recruited 3,634 females who had anxiety, depression, and sleep disorder, and later the mothers rated their children for ADHD symptoms around 4 years of age. This was a prospective correlation design. The measurement they used included questionnaires, and DSM-IV was used to diagnose ADHD on children under 7 years of age. And also they used DSM-V for sleep disorders. They also used linear regression model to analyze the data. They concluded that there is a positive correlation between maternal lifetime anxiety, sleep disorder, and depression, and ADHD symptoms at 4 years of age. 402 mothers that we reported with at least one mental disorder had a child with an average ADHD score of 3.6, which is above normal. Mothers with anxiety and sleep disorder had children with higher ADHD 8 score. The scores were higher when the disorder was present during the pregnancy compared to before.
For our fifth and final article, it was titled Maternal Depression, Anxiety, and Stress During Pregnancy and Child Outcome, What Needs to be Done, Best Practice and Research Clinical Obstetrics and Gynecology. For the purpose, it was to see if there's a relationship between maternal depression and newborns' increased risk of having cognitive disabilities. The sample were of 88 studies being reviewed, and for the design, there wasn't a necessarily specific study design as it was only a review article, and the measurements used in this review article were seen by observing information in past studies to provide more data. The data was analyzed by interpreting previous studies' research and how they would provide evidence to the issue being studied currently. The results show that there was a correlation during pregnancy of depression in mothers and their children who could have ADHD. In the study, it also expresses how depression during pregnancy, rather than anxiety, increases the chance for a child to have ADHD. In caring for patients, screening for depression and support groups should be implemented to help with it during pregnancy.
For our synthesis of research findings, within our 5 research articles, 3 of them use the same type of sampling. Research articles 2, 3, and 4 all used random sampling, and they chose this because it avoided bias. Our 5 articles also all measured similar variables. The independent variable in the articles is the mother's depression, while the dependent variable is the child's ADHD. Then for our findings, each article contained information that correlated to our research question, as well as proving support into the relationship between clinically depressed women and their children developing ADHD. In our first article, It completed a study following mothers who had depressive disorders from gestational week 12 to delivery. And the results were that when a mother has depressive symptoms during this time of pregnancy, it can increase the chance of their child to have ADHD symptoms from ages 3 to 6. Then for our second article, it completed a study that focused on a child's psychopathology and how it can be affected when exposed to maternal depression during pregnancy. And the results were that when a mother has depressive disorders during pregnancy, there is a 20% increase in their child having ADHD later in life.
So for the third article, they looked to see if there was a correlation between prenatal antidepressants and children with ADHD, and looked at children from birth to 14 years of age, and they found that there is a link. And the results show that mothers that have depression take prenatal antidepressants, and it increases their risk for their child having ADHD. For the fourth article, they found a correlation between maternal depression and ADHD. And the results showed that there is a link between mothers who have depression, anxiety, and sleep disorders during pregnancy, and the children having ADHD symptoms during around the age of 4. For the last article, it looked how more mothers are having depressive symptoms during pregnancy that can then affect the child later in life. And they took results from multiple studies that proved the correlation how disorders during pregnancy can lead to their child to have ADHD later in life.
To conclude, the goal of the research was to find articles that explain how maternal depressive symptoms during pregnancy are correlated with children who have ADHD. After our research, we found that maternal depression during pregnancy increases the chances of having children who have ADHD between ages 3 to 6. Some of the implications we can apply are monitoring pregnant women and have them screened for depressive symptoms during pregnancy. Pregnant women should be provided with information regarding coping mechanism for stress and depression. Finally, they should try relaxation techniques and be offered support groups or counseling to cope with depression.